Welcome back. So we've been talking about how to revitalize the tourism sector in Nigeria and the hospitality sector. But while we do that, it's been mentioned that we stand the risk of getting a second wave of COVID-19. And so people have been advised to take care of themselves, wear masks, and respect social distancing. And to continue that conversation with me, I have Dr. Iseko from CARDIOCARE Multi-Specialist Hospital. Welcome to the Weekend Show.
Thank you very much for having me.
So let's go to it. Do you think that, I just saw on our headlines that NCDC has said there isn't like a significant rise in cases, but reality is that the coronavirus is still out there and Nigerians are still contracting it. Now, it's almost December and a lot of people will be returning to Nigeria from areas where coronavirus is still high. And there are also the chances of even being tested, it's still skipping through the borders and coming in. Do you feel that's a reality, and do we stand the risk of getting into a second wave of COVID-19 in Nigeria this December?
Thank you very much for having me. The truth is that COVID-19 has been a topical issue around the world, and the second wave is really happening everywhere else around the world, and surprisingly not so much in sub-Saharan Africa. The data we have shows us that there probably are some ameliorating factors in our setup, likely due to sun, climate, way that the virus travels, our exposure to sunlight that increases our level of vitamin D. And then there has been postulations that vaccines that we have taken for things like tuberculosis, which we still take in this part of the world, which most parts of the world have stopped taking because they don't have it as much, may have played a role in changing our immune systems to be able to better handle this. I'll remind you that the common flu has always in the past in other countries. In America, the common flu kills over 600,000 people every year, something about that nature. Why in Nigeria we don't hear things like that? So we have never really been kind of susceptible to that kind of ailment. But that being said, there are a lot of people that have unique proclivities whereby they could fall prey to COVID-19. People that have diabetes, heart disease, hypertension, people that were already sick ab initio, they could really be at risk and could really die from this thing. So it's important that we still maintain all the necessary protocol. Even though I do not think personally, and based on my experience, I do not think that we'll probably have that massive surge that we'll see. We'll probably have different strains in different ways. And the problem, however, will now be how much testing can we do to be able to differentiate it from malaria. Because somebody has malaria and gets well, or somebody has COVID and gets well, how will we know which was which? And so that we really have to scale up testing to the primary healthcare centers, secondary care, private hospitals, public hospitals, so that everyone that has a febrile illness is tested. Then we can be able to differentiate and be able to give good epidemiological data.
You know, it's interesting that you said, and I'm not in the medical space, so I don't know what's going on specifically as regards research, but it's important that there's some form of research between the impact of COVID-19 vis-a-vis malaria to see how we can adapt to it. But earlier in the year, we saw the borders closed. We saw people couldn't travel. And so a lot of the spotlight was brought to local Medicare and medical tourism. Now, interestingly, your organization just set up a CARDIOCARE multi-specialist hospital. How does that stop us from traveling abroad for treatment?
Okay, so it's known that Nigeria spends over $2 billion annually going abroad, most of which is spent in four major specialties: cardiology, oncology, orthopedics, and nephrology. So during this COVID period, we read grim stories of people not being able to travel abroad, having needed a pacemaker or the other, or some things that could not be done before now in Nigeria. And so a lot of work has gone in before now, mostly in Lagos and not so much in the northern part of Nigeria. And so what CARDIOCARE has set up is what we call a cath lab. The cath lab essentially is a big machine where we put people in and we can operate on the heart while they're still awake. They are talking with us. We pass small wires through them, through the equivalent of what you have like an injection. Just the same way we put an IV line, through that same way we pass wires to the heart and we're able to fix that. What that has done is that in essence, most of those people have had to travel to put in a pacemaker. But more importantly, is that When somebody has a heart attack, he literally has 90 minutes to 3 hours to get that life-saving treatment. Even if you had all the means, how do you get from here to an airport to outside the country in 90 minutes to 3 hours? That would not be the best. So what eventually happens is that people tend to die off or have to travel somewhere else. So putting this down in this kind of climb is quite important and makes a big difference. And so we've had people come in, because this is the only functional indigenous cath lab in northern Nigeria. We've had people have to fly from Sokoto, people with heart rates as low as 29. So the heart is typically supposed to beat about 60 to 100. When the heart starts getting too low, they tend to faint, they tend to fall down, and we have to quickly rush and put a pacemaker in, connect wires into the heart, and then it gives the heart a regular rhythm. That has really revolutionized how we do medicine here. In fact, it has been available outside the country for a very long time. But however, bringing it to Nigeria has been challenging. A lot of finance is involved, a lot of expertise is involved, a lot of training is involved. And so that's what we've been able to do to help impact. And hopefully, our hope is that we'll be able to reverse medical tourism. We want to see people from neighboring countries, Ghana, Senegal, Cameroon, flying into Nigeria, and Nigeria can now be the hub for sub-Saharan Africa, being that the European countries have become a real hotspot in terms of COVID-19.
Okay, so we have our number on the screen. So we have your number for how people can reach your hospital and that's 081744408888. That's 081744408888. And so I thought about the medical tourism part. Countries like Germany and the UAE, they make a whole lot of money from medical tourism.
Indeed.
And I had come across your CARDIOCARE center just in about March, when this was when the virus and the lockdown was about to start massively, and I didn't know about it prior to coming in contact with this facility. Why is this so? So is it that? So there's a possibility that we could have different centers like this in Nigeria. So are you guys the only ones who offer this? And why is it that people don't even know that we have these services in Nigeria, or would rather still go out?
So it's a dual-pronged issue, actually. The truth of the matter is that the medical law doesn't allow hospitals and people to advertise. Okay. And so while most foreign hospitals can advertise, and local hospitals are typically been unable to advertise for the most part, although there are some changes to the law to help and allow some of these things to come in slowly under the government, but it's very difficult to advertise, and so people do not know what is available inside the country. So people could actually be literally living next to a hospital that could help them, and will be moving around looking for where to go. That is one aspect. The second aspect is the idea of that things coming from abroad is ostentatious, it's more superior to anything coming from the country. So people generally want to buy tomatoes, foreign tomatoes versus local tomatoes, foreign rice versus local rice, foreign shirts versus local shirts, and so foreign healthcare versus local healthcare. It becomes a goods of ostentation. I mean, I just went abroad for my checkup, and for things that could be done here in Nigeria. Before now, there have been about 4 or 5 cath labs available in Lagos, and 1 in Ogun State. And UNN, University of Nigeria, also has a cath lab, which was recently put into use in the last 1 year. Okay. There is a cath lab in Abuja also by a foreign agency, mainly run by foreign nationals. And then in the rest of the north, CARDIOCARE, who owns the only indigenous lab that is functional now for the whole of the north. Since March till now, we've done over 70 cases successfully. That is putting in different devices, opening blocked arteries, finding what's the problem. And interestingly, the procedures take about 30 minutes, 45 minutes, and somebody's really back to where they're supposed to be. That's quite important. So that is the two-pronged approach. First is from the idea of people feeling that, are you sure that anybody can do anything well in this country? And then the second approach is also that hospitals have some limitations in advertising, so you don't see so many hospital adverts in newspapers or all over the place. So that is quite a significant
without necessarily advertising, I'm glad we're able to have this conversation and you could talk about it. But where can we find CARDIOCARE multi-specialist services?
So
Hospital?
CARDIOCARE is located in the heart of Abuja, next to the FCDA Secretariat. And this week we'll be doing an official launch of the cath lab and the cardiac surgery theaters and the ICUs. We'll be doing an official launch, even though we've put it to use to make sure that everything is working well. This week on Thursday, we'll be hosting different government dignitaries to officially open it, and we've kick-started a lot of partnerships with the government to make sure that public-private partnership in the delivery of healthcare to Nigerians is optimized. And so in Area 11 Garki, next to the FCDA, FCDA Secretariat, CARDIOCARE is located. CARDIOCARE is actually a brainchild of the Limi Hospital Group, which was founded in 1982. And so for almost 4 decades, it has been in Nigeria offering
Dr.
healthcare to
Iseko,
Nigerians.
I'll send you a bill in the mail, a huge bill for this. But it's been a pleasure talking to you.
Thank you
All
very
the best with what you're doing, and we hope more Nigerians will resort to indigenous facilities such as yours, and that it also attracts other Africans to your center and centers such as this. To our guests at home, that's been it on the lifestyle segment. Don't go away as we have more on the weekend show.